Welcome to the first section in our ophthalmology series, Ophthalmology in General Practice. In the next 10 minutes, you will learn when an eye-associated complaint should be seen. You'll be able to identify breed and lifestyle predispositions to eye issues. You'll be able to identify what the most common cause is of red eye, and you'll have a quick guide as to when a specialist is needed. Prioritize the eyes. Prioritize all calls that express concern about a potential ocular difficulty. The call could be a perceived vision issue or physical problem with the eye. The verbal description is unable to convey the true nature or severity of a problem. Seemingly innocent conditions can rapidly result in an ocular emergency. These cases simply must be seen right away. If an owner calls to say, "My dog is squinting," well, any dog could develop a mild eye irritation, tearing, and squint. This could be a minor irritation from dust or pollen that will resolve on its own, but without direct examination of the eye and attendant structures, it is impossible to know if the squinting is due to a tiny scratch on the cornea, a foreign body beneath the third eyelid, or a penetrating wound. One of the very first signs of disease elsewhere in the body, such as a systemic fungal infection or cancer, could be an innocent looking squint. Don't delay, see that eye. Any injury to the eye should be seen by a veterinarian immediately, within 12 hours if possible. The sooner the eye is treated, the better the chance of preserving vision along with relieving pain. There are breed predispositions to eye difficulties. Our brachycephalic breeds, such as pugs, shih tzus, and bulldogs, commonly suffer from corneal exposure as well as corneal dystrophies that can cause discomfort and vision loss. Dogs with long hair around their faces, such as sheepdogs, poodles, and Maltese, can be more at risk of eye irritation and secondary infection. Or their lifestyle may put them at risk. Dogs commonly suffer from trauma-based ocular disease such as penetrating wounds or foreign bodies. Commonly, there will be concurrent corneal laceration or ulceration. Even vigorous rubbing of the eye can cause ulceration. Injury may result in prolapse of the eye from the socket. Signs of eye trouble may be physical, behavioral, or both. You may notice a color change. Many problems start with the red eye. There may be color change across the surface of the eye or within the eye. You may see an increase in tearing, or squinting, or rubbing at the face or head, or excessive blinking, cloudiness, or discharge. There are some common causes of inflammation and red eye. Conjunctivitis, the mucous membranes of the eye become inflamed and itchy, the most common eye problem in dogs and cats. Glaucoma, a much more serious condition caused by increased pressure within the eye itself, or allergies, allergy-induced itchy, watery eyes. Epiphora is the term for watering eyes. Maybe a foreign body, a foreign object in any part of the eye, even eyelashes, can cause the eye to be irritated. Or a scratched cornea. This may result in a simple, uncomplicated ulcer, but it can develop into a more serious condition if not addressed promptly. Or entropion, where the eyelashes are turned inward instead of outward. They rub on the conjunctiva and possibly the cornea. The irritation causes the eye to tear and develop conjunctivitis. Entropion can cause corneal ulceration and infection if not treated. Or dry eye. If the tear glands are no longer making tears, the eyes will become very irritated and red. Checking tear production is a must for every patient with a red, irritated eye. Or uveitis. A red, inflamed eye may be due to inflammation inside the eye. This is called uveitis. This can be a sign of disease elsewhere in the body. A red eye can be due to a bleeding problem such as low platelets or abnormal clotting factors. So when do you need a specialist? When the eye condition has not responded to the recommended therapy, when the pet's vision seems to be deteriorating despite treatment efforts, or when a corneal ulcer has not responded to treatment. You may need a specialist when dealing with diabetes, which generally leads to cataracts. A consult may be needed even before the point when cataracts are causing complete vision loss. Specialists also have a role with responsible breeders who want to ensure their animals have no inherited ocular disease. Thank you for joining us as we talked about ophthalmology in general practice. Join us for our next segment where we go into dry eye in much more detail.